We're going to review the procedure to identify potential COVID patients and the PPE we should be wearing and when. The EMD protocols in the system have been updated to try and capture as many potential COVID patients as possible before EMS arrival. We are erring on the side of caution and looking to capture any patient with any concerning symptoms. The caller will be asked if the patient or themselves has measured a body temperature greater than 100.4 degrees Fahrenheit, a fever, hot to the touch and room temperature, chills, difficulty breathing or shortness of breath, persistent cough, and any other new respiratory problems such as persistent sneezing, wheezing, or congestion. If any of these are positive, they're considered a COVID-19 patient and require PPE. The dispatch will tell the patient to avoid close contact with others, wash their hands, put on a surgical mask if they have one, and will ask the patient, if possible, to meet the responders outside if it's safe to do so. We will be given information from dispatch that we have a potential coronavirus COVID-19 patient. When we arrive, we'll don appropriate PPE. The doors between the patient and driver compartment should remain closed at all times, and we should confirm this before getting out. Consistent with new CDC guidelines given the N95 shortage, we'll be using surgical masks for initial contact. Both providers will don a surgical mask, gloves, and eye protection prior to making patient contact. One provider will approach the patient and give them a surgical mask, not an N95. The patient should be always given surgical masks regardless of the circumstances. The second provider will watch from at least 6 feet away and act as the safety officer to ensure that the first provider does not become contaminated. If 2 providers are needed for patient care, a third person can serve in that safety role. We're going to limit physical interaction with the patient to only what is necessary. If the patient is able to ambulate and it's safe to do so, we should allow them to walk out to the ambulance. After we get to the ambulance, the minimum number of providers necessary will get in the back, and the driver should take off their gloves, clean their hands with hand sanitizer, and drive with a mask on. The vents in the back should be placed on high for the duration of the transport. When we get to the hospital, the driver should tell the staff that we've arrived and get directions from them on what to do prior to taking the patient out of the ambulance. If the patient is ambulatory, we should allow them to walk into the ED. If not, they'll be brought in on the stretcher. The driver should wear gloves regardless, even if the patient is ambulatory, in case assistance is needed. The doors of the ambulance should be left open and the exhaust fans left on. After the patient is dropped off and care is transferred, you should take your mask and gloves off and dispose of them, then wash your hands with soap and water, only using hand sanitizer if you're unable to wash your hands. You should then put on a new pair of gloves and decon the ambulance with wipes. Make sure to thoroughly clean any potentially contaminated surfaces and equipment. Remove your eye protection and clean with a wipe and set down and let them dry. Take your gloves off and wash your hands. If we're going to be performing aerosol generating procedures, we'll add an N95 and gown. This will include airway procedures such as BVM ventilation, endotracheal intubation, King LT, CPAP, neb, vent, or suction. We will now be using the King LT as our primary advanced airway tool over endotracheal intubation. For all of these procedures aside from suction, we should be using the HEPA filter, which can attach in line with the airway devices or in the back of the neb. We want to take the time to completely unfold the N95 and ensure it is completely covering the nose and mouth, using that metal part to improve fit around the nose. If we take a quick breath in with the N95 appropriately placed, we should actually feel that mask suck to our face as it's appropriately sealed. The gloves should be placed on over the cuff of the gown, and the gown should be tied in the back. If the driver needed to don this PPE, they should remove the gown and gloves prior to transport and drive again with the mask on. To remove this PPE, we'll follow a similar procedure used by surgeons to break scrub. We'll grab the front of the gown and pull forward, which will tear the tie, and we'll be able to now pull the gown off. We should pull the outside of the gown only with gloved hands and pull forward until the gown is completely draped over us. We can then grab the outside with a gloved hand, grab the outside of the gown, pull over one side, and we'll remove the glove and the gown at the same time. We can then use the ungloved hand to reach around, grabbing the back uncontaminated side of the gown and pull forward. We've now removed the other glove and gown at the same time. We're now holding the gown on the uncontaminated inside, and we should dispose of that. Next, we need to remove our mask. We're going to grab the back strap of the mask, pull forward over our head and dispose. Then we're going to grab the back of our goggles and pull them forward over our head and off. We're going to clean the goggles with a wipe. We want to treat the front of the gown, the gloves, the front of the mask, and the front of the eye protection as potentially contaminated, and try not to touch those surfaces. After we've removed all of that PPE, we should immediately wash our hands with hand sanitizer. We're following these guidelines to limit the number of personnel who require the use of PPE. If you're not first on scene, make sure to call the units on scene on Channel 5 and see if they need assistance. If they don't, remain outside and don't don any PPE. We're also limiting the use of PPE to only what is necessary for each call. These guidelines will keep us protected, but not use unnecessary PPE. As with everything, these guidelines and equipment could change at any time, and we'll keep you updated on our current standard. Thank you.